of us like the phrase long in the tooth, and we don't want it to apply to us, certainly. We often think we're too young for receding gums. But now there's a new easy fix working through a tiny pinhole to fix any receding gums. In San Diego area periodontist Dr. Tina Beck, who has her practice in Scripps Ranch, is joining us now. And thanks for being with us.
Thank you for having me.
A lot of people are interested in this. It's not something you normally talk about, but I think that we often think it just applies to people who are older, and that's not the case.
Yeah, that's true. I've worked on a lot of young adults, teenagers, and even children to fix their gum recession.
So what is gum recession then? What are the signs of it?
Well, gum recession is when your gum tissue actually detaches from your tooth and it exposes the root of the tooth. And the root of the tooth can be very sensitive to cold or even just air. And then it also makes you more susceptible to developing really deep cavities.
Now, usually we think about that the way you take care of this is surgery and stitches and most likely a lot of pain. But you have a new and innovative way to treat this. What is it called and how does it work?
The pinhole surgical technique, also called the pinhole gum rejuvenation technique, is developed by Dr. John Chow, and he created it a few years ago, about 10 years ago. And now he's training dentists, general dentists, to perform the procedure. And it utilizes a tiny pinhole to move the gum tissue to cover the root surface without needing any grafting, doing any cutting, or any stitches.
So you really can correct receding gums quickly. I'm looking on the screen, and what are we looking at? This is just a...
This is a little video diagram of how gum recession can occur after orthodontics. During orthodontics, when the teeth are moved, sometimes the gum tissue is too weak to move with the tooth. Traditional gum grafting would involve taking some gum tissue from the roof of the mouth and transferring it over to the area of recession.
Okay.
And then the gum is lifted, the graft is placed underneath, and it's all stitched into place.
You've done quite a bit of that, haven't you, in your day?
Yes, I've done lots of them.
Okay, so
but now there's the pinhole technique.
And then there's a pinhole technique, which you said can be done in minutes, and it's not nearly as painful.
That's correct. Yeah, just through using this little pinhole in the gum tissue and no cutting, you can actually cover one tooth or even the whole mouth in 30 to 60 minutes.
Okay. Well, I definitely want to see how this works, so hopefully we can throw up some video to look at that. But also, just what happens if you don't do anything?
If you don't do anything, like I mentioned before, you can develop some sensitivity, or you can get cavities deep into the root surface, and you can end up actually losing the tooth in some cases.
Okay, so, and then how long does this take? If somebody's going to come in and get this procedure done, which I know that you do, how long?
It depends on the size of the area to be treated, but it can be 30 minutes to 60 minutes. I've done a whole mouth in 90 minutes.
You have, and then what is the feedback that you get?
They love it. A lot of these patients have known about the recession for a long time, and they probably have gotten a couple consults, and they just never followed through with it because of the perceived pain of traditional grafting.
Okay, so this is the other way. This is what you're talking about then.
Yeah, this is the pinhole surgical technique, or pinhole gum rejuvenation technique. And you can see the instrument placed through the little pinhole is guiding the gum tissue down into the correct position. Then these little collagen strips are placed through the pinhole to help stabilize and thicken the gum during the healing process. And those strips are dissolved over the next few months, and the gum stays in place.
Okay, that looks way better than the other way, the traditional way with all of the stitching and cutting and moving and all that stuff. What is the price comparison in general between the two?
Again, it depends on the size of the area to be treated, but it ends up being about the same price or maybe even slightly less.
Okay, and then how can people find out more about this treatment? Is it being done in a widespread fashion, or is it just a few of you that do it so far?
So far, there's just a few of us that have been certified and trained. There's only 1,500 dentists all over the world that have been trained to do it, and if you want to find a dentist in your area, then you just need to contact the Pinhole Academy.
Okay, very good. We have some few before and afters, just so we can show some people. This is not real teeth. This isn't graphic, but you get the idea. Okay, so that's the before and the after.
A before and an after, yeah, in a cartoon version.
In a cartoon version, okay. Very good. So here's the real version.
Here's a real version. This is before and after, and I believe that's just a day or two after, so the results are very immediate.
Oh, what a difference. Yeah, I'm sure they're very happy with that, especially.
Yeah, and then here's a more dramatic
that looks
case.
much better.
Yeah, and all of that could be done in one setting, and within 2 or 3 months is completely healed. Unlike gum grafting, that could take a year to treat with multiple surgeries with gum grafting. So the pinhole technique is really nice for busy people who don't want to take a lot of time off work for appointments for the dentist, or people who want instant results because they have a wedding or a high school reunion coming up.
And they can go to it within a few days?
Yep.
That's great. All right. Dr. Tina Beck, thank you so much for being with us.
Thank you so much for having me.